Hooded eyelids are not a major problem anymore because we can treat it with a method that's non-surgical, has a minimal downtime, it gives results instantly, they're visible during the process, you can book it easily, and it's done within half an hour. PlexR is a very revolutionary method that is an alternative to a surgical blepharoplasty. We have so far treated hundreds of clients with this procedure, and one thing so far we have seen is that nearly everyone is extremely happy with the procedure, as it is really very effective and the results can be compared with a surgical blepharoplasty. Patients ask, how can I possibly have a surgical result with a non-surgical blepharoplasty? The technology is fusion plasma. That means we generate heat through a little device, and that blasts away or removes excess skin in all areas. For example, hooded eyelids. It's a very common phenomenon as we age, as the skin loses its laxity and its elasticity because of the aging process. The procedure itself is a very fast procedure, very efficient, and there is no pain involved. The reality is this technology is unique. It involves little ablations with a special device, and the skin is minimized and shortened during the process. Every time we do this procedure, we take about a third of the excess skin. Sometimes multiple sessions, up to 3, may be required to achieve the effectiveness or the optimal result. Clients with darker skin need to consider a preparation session or a preparation course of medication we will prescribe and tailor accordingly. And also there's going to be some specific aftercare after the procedure, which involves skincare in form of topical creams or even injections or infusions. This will be discussed with each patient individually when they attend for their consultation. The downtime of the procedure involves brown scabs on the area treated, swelling which lasts 2-3 days, and after that redness on the treated area. Everything resolves within 4 to 7 weeks. Patients ask me, "Doctor, will I have permanent results?" It's the same with surgery. The physiological aging will continue. If there is a genetic tendency for the skin to become excessive on the eyelids, it will happen again, but the effectiveness of the procedure is very prolonged, I would say for several years, but this is also the same with the surgical blepharoplasty. People often ask me, can I have this more than once? Of course. Remember, this is not a surgical procedure. This is non-surgical, and this procedure can be repeated according to need. So there is no limit, there is no cutting, there is no bleeding. PlexR for hooded upper eyelids, it's an excellent alternative to surgery. My treatment of choice for hooded eyelids because of the minimal downtime, pain-free, no cutting, no scarring procedure.